of the spinal cord, its organization, especially the motor reflex. We will talk about the sensory receptor of this reflex, which is the muscle spindle and Golgi tendon. This is the bulk of the lecture. A little bit of examples of different reflexes in the spinal cord, the flexor and the withdrawal reflex, and just a brief discussion of the autonomic reflexes in the spinal cord. So I see the spinal cord as the interconnections between the brain and the peripheral system. Pero hindi siya magulong computer system na composed of wiring. It's highly intricately organized. Napakaganda ng pagkaka-organize ng mga sensory fibers, motor fibers, all together, grouped depending on certain muscles for a specific function. So there is no other connection of skeletal muscles from the cortex to the skeletal muscles, but through the spinal cord. So if there is damage to the spinal cord, the connection is affected. So there will still be some activity of the skeletal muscles, but it will not be within the control of the spinal cord. Most of the activities are subconscious, but it doesn't mean that the cortex will not have an effect on these muscles, because important yung control ng cortex to these muscles. An example in advance is yung tone. Hindi mo naman iniisip yung tone ng muscles mo, but it's there. However, pwede namang mapa-increase mo yung tone yun if you have isometric contraction, for example, and that's with the stimulation coming from the cortex. Okay, so just a brief review, although this should be discussed in neuroanatomy. Yung spinal cord has a gray matter and a white matter. Yung gray matter, that's composed of the cell bodies, diba? Whereas the white matter, this is more of the axons. So the gray matter is butterfly shaped. It has a dorsal horn, lateral horn, anterior horn. So pag white matter, it's divided into dorsal column, ventral column, and lateral column. So you see by the term lang column at saka horn, nagkakaiba sila in terms of gray matter or white matter. So sikat na sikat si dorsal root ganglion. We've been talking about this in the previous chapters, and this is a collection of cell bodies outside the central nervous system. And that's the entry of those sensory fibers coming from the periphery. Whereas the where the efferent pathway out. Okay? Ha? Okay ba?
Choppy po, Doc.
Choppy? Choppy? Gaganahan na pa naman ang pag-lecture, no? You just tell me anytime pag mag-choppy. Okay. So, there are interneurons, and later I will tell you the importance of these interneurons in the reflex arc. Importante din yung interneurons. In fact, some connections from the cortex hindi agad-agad goes directly to the motor or to the motor system, but it goes to the interneurons, then saka na sa motor system. So halos lahat ng input coming from the cortex has to go to the interneurons, pero hindi naman lahat din, okay? So the interneurons are there to either inhibit or stimulate. So yan yung integrated processes occurring in the spinal cord. So siya yung pinaka decision making sa spinal cord, yung interneurons. In participate, yung palang sinabi ko, nandiyan pala. So the interneuron, it participates in the integration of incoming information and produces responses through the reflex mechanism. So yan yung spinal cord function. We will talk about the reflex mechanism in a while. So major communication link between the brain and the peripheral nervous system, that's the function of the spinal cord. Okay. So this is the reflex arc. Kailangan nyo siyang i-memorize, although napakasimple lang naman ng concept niya. I think madali nyo siyang makukuha. So, for example, you have a noxious stimuli, it will be received by the sensory receptor, and this sensation will be processed through the sensory neuron up to the dorsal root, and then it will synapse with the interneuron. So once in the interneuron, some of the information will go up into the cortex or the thalamus to the cortex, but some of this information will go directly to the ventral root, the efferent pathway through the motor neuron, and then stimulate a specific effector organ to cause a reaction. So an example of that is may mahawakan kang mainit. So sobrang init niya, so yung yung sensory fibers will be stimulated, and then it will go to the dorsal root ganglion, and then immediately to the interneuron, stimulating the motor neuron, spinal nerve. It goes up to the spinal nerve, and then stimulate a certain muscle in your hands to remove your hand from the source of the pain stimuli. But then there are some information that will go also to the spinothalamic tract up to the cortex, and you will eventually be aware of the noxious stimuli. But before ka naging aware, na remove mo na yung hand mo. So ganun kabilis si reflex arc, hindi niya hihintayin yung decision from the cortex. So importante din naman na ma-stimulate si cortex because you will try to identify if that noxious stimuli is kailangan mo bang i-maintain na you go away from that, parang ganun. Or sinadya ka ba talagang sunugin? Alam mo yun, you have to defend yourself. Parang
Rapido. Dok, rapido.
Dok, you're choppy po.
Topic ako, Dok. Dok, choppy.
Dok, you're choppy po.
well, most paano ako mag-transfer? Gusto ko mag-transfer sa smart. Baka mas malakas yung smart. Kaso lang, pag mag-transfer na naman ako, mawawala na naman kayo, lahat. Katulad ng last time. Kasi nasa laptop to eh. So, paano kaya?
Dok, pwede naman po siguro you leave the meeting para mag-transfer to Smart, tas ako na lang po muna yung...
Paano ako magli-leave?
Ano po?
End meeting?
Yung
Ano ba?
sa baba po may nakasulat na leave meeting, assign host. Meron po ba yan?
Parang wala.
Or you,
Ang nakikita ko lang is end meeting.
oh,
Kaya nga yun yung dati kong pinindot.
what if
Sige nga.
i-assign mo ako as host?
Sige. Tapos pag i-assign kita as host, mapapatay siya, di ba, in an hour?
Oh, I'm not sure po, Doc. I'm sorry.
I think mamamatay hiya in 1 hour kay it imo account. Bongga ba't imo account?
Ay, hindi po.
Ay, sorry. Sige nga, make host. Change host. Feeling ko mapag i-end meeting ko. Sige daw, try ko, Adi, ha?
Kasi leave meeting at ako.
Ay, nakita ko na. Leave meeting. Okay,
Opo.
wait lang, ha? I'll transfer.
Okay, Doc. Ingat.
Hello? Am I in or am I out?
You're in na po, Doc.
Pero low-tech siya. Kasi ano lang, hindi earpods. Anyway. Pwedeng kayo na lang yung mag-share ng slides ko. Nakuha niyo ba?
Oh, yes po, Doc. Sandali lang po.
Pa-share na lang ako, girl.
Okay po, Doc. Sandali.
Kasi cellphone lang. Ang hirap ng buhay, no? Yan ang drawback pag virtual. So hanggang saan yung narinig nyo? Hanggang sa dulo ng walang hanggan.
Doc, can you see it na po? Hello?
I can see it na.
Okay po.
Sige nga, next. Naglalag lang.
Oh, yan na po.
Reflex arc, I hope narinig nyo, pero kung hindi, kunwari may nahawakan kang mainit, then free nerve endings will be stimulated. that sensory receptor in the skin, and then it will send the information through the sensory neuron into the dorsal root, ano? Tapos mag-connect yan sa interneurons in the spinal cord. And then the interneurons will synapse with the motor neuron, and then that's the efferent pathway. It will stimulate a certain muscle in your hand. You will remove your hand. Okay? Yan yung immediate response. That's a reflex arc. Most of the time, it is in a subconscious level. Pero meron din yan in a conscious level. Kasi pagdating ng efferent pathway in the dorsal root, it will send impulses to the cortex via the spinothalamic tract to make you aware of what's going on. So yung after mo ma-remove yung hand mo, you will try to look at the environment kung bakit ka ba napasok. Katangahan lang ba or pasok ka ba talaga? Hindi, syempre man, sasampal ka na after that. That's the cortex level na. Anyway, so next slide. The gray matter, the cord is integrative area for the cord reflexes. So you have sensory root, gray matter, and then some information will go to the higher levels of the nervous system for you to be aware of what's going on. Next. Yes. So we have talked about last time sensory neurons. Ito naman, there are other, nakalimutan kong ilagay dyan, nakasulat lang dyan, there are 2 types of neuron. Hindi lang 2 types yan. There are other 2 types which we are going to discuss today. Kasi maraming types of neurons yan. But our discussion will focus on these 2 types of neurons. Yung anterior motor neuron, which gives rise to the nerve fibers that leave the cord by way of the anterior root and directly innervate the skeletal muscle fibers. So the other one is an interneuron. So let's start with the anterior motor neurons. Ito yung mahirap kasi yung anterior motor neuron, there are 2 types. You have an alpha motor neuron and the second type is gamma. So first is alpha motor neuron. It gives rise to large type A alpha motor nerve fibers, which branches many times after they enter the muscle. So it will innervate a large skeletal muscle fiber, but individually stimulating muscle fibers. So each muscle fiber, each motor is called a motor unit. So one single large type A alpha motor nerve will stimulate several nerve fibers, muscle fibers. We call it a motor unit. Okay, so alpha motor neuron and the other one is an interneuron. In the alpha motor neuron, there are 2 types, large type A alpha motor nerve, and the other one, next slide, is a gamma motor neuron. So it will, yun na yun, wait lang. So see, alpha motor neuron is more of a skeletal muscles. Once you stimulate the alpha motor neuron, it will cause contraction of a specific muscle. Let's say your gastrocnemius, or is it the quadriceps, parang ganon. Whereas the gamma motor neuron is under an anterior motor neuron, but it's more of a basic muscle tone, yung tone. So ma-appreciate natin siya if there's a damage of gamma motor neuron, it will cause flaccidity or an excessive activity of this gamma motor neuron, it will cause spasticity. So it's more of a tone. But yung gamma motor neuron is small type alpha gamma motor neuron, whereas the alpha motor neuron are large type A alpha. So ganun siya. So gamma motor neuron are small type A gamma motor neuron. So yun. Next slide. So the second type of neurons in the spinal cord, in the gray horn, is the interneuron. So para sa akin, na-appreciate ko ngayon yung importance ng interneuron is it's present in all areas of the gray matter. It's a small and highly excitable, often exhibiting spontaneous activity and capable of firing as rapidly as 1,500 times per second. It has many interconnections with one another, and many of them also synapse directly with the anterior motor neuron. So almost all synapses coming from the sensory or the dorsal root has to synapse with the interneuron before going into the anterior neuron. Meron lang, as far as I can remember, the corticospinal tract, most of its tract coming from the cortex, single order neuron lang siya diretso to the anterior motor neuron. Pero most of the time, it has to connect with the interneuron. Okay? Next. Kakaiba si Rencio cells. Okay? Kakaiba siya. This is not an interneuron, but these are cells at the sides of the anterior motor neuron. Its effect, its benefit is more on inhibition. Parang, for example, you want to, kunwari yung, nahawakan mo yung mainit in your right hand, and then a specific muscles will be stimulated to remove your right hand. So the other muscles has to be inhibited. So yung Rencio cells is more of a specific intricate activity. These are sa mga artists or pianist, parang ganun ba? Kasi kailangan inhibited yung iba para specific intricate activity ang ma-perform mo. And this happens by lateral inhibition. So we have talked about lateral inhibition in sensory fibers. Ito yung sa example sa sensory fiber, di ba? If you have a two-point discrimination, you are able to identify the 2 points if the 2 points because of lateral inhibition. The other sensory fibers are inhibited para ma-identify mo kung naasang area, surface of the skin, yung specific stimuli. Okay? So sa motor din, ganun din. By lateral inhibition, by inhibiting the other motor neurons, a specific muscle will be stimulated to perform a specific activity. So importante siya because it will focus or sharpen its signal in the same way that the sensory system uses the same principle to allow unabated transmission of the primary signal in the desired direction while suppressing the tendency for signals to spread laterally. Okay? Next slide. Okay, so muscle spindle tayo ang Golgi tendon. So don't be confused. In the reflex arc, there is that sensory area and there is that interneuron and the motor neuron. Or the efferent pathway. Tapos na tayo sa efferent pathway. Inuna ko yung efferent pathway. So the efferent pathway there is the alpha motor neuron and gamma motor neuron. Didiscuss na natin si interneuron. Okay, it's the connection between sensory to motor. Now let's talk about sensory pathway in the reflex arc. So there are two types there, the muscle spindle and the Golgi tendon. So from the word muscle spindle, they are located in the belly of the muscle, and it will give signal, it will be stimulated if there is a change in the length of the muscle or the rate of change of length. Sobrang laki ba ng change of length or sobrang liit lang, parang ganun. Golgi tendon are located at the tendon side. And ganun din, it will send signals if the tendon are tensed or if is it lengthened too much, and it will prevent yung maputol yung tendon. So ganun siya. Okay? Next slide. So almost 1 centimeter is the muscle spindle, and it's about 3 to 10 millimeters long, built by around 3 to 12 tiny intrafusal muscle fibers, which are surrounded by large extrafusal skeletal muscle fibers. The central region has few or no actin and myosin filaments that thus this central portion does not contract when the ends do instead, it functions as sensory function. So ang ibig sabihin lang nun, it is located in an area with less actin and myosin, but it's more of sensory information only. However, if this area has a change in length, or if there is a contraction of the muscle, this muscle spindle will be stimulated. Okay, next. Oh, wait, I forgot to say. Look at the diagram there. There is that sensory. Okay, that's the muscle spindle. Within the muscle spindle, there are sensory, the primary fiber, and the secondary fiber. So the primary fiber, we will expound it later. It is, once stimulated, it can cause a certain effect. If both the primary and the secondary, it will cause us another effect. So yun yung importante. So makikita nyo rin doon sa muscle spindle na merong nag-supply din na motor. So if this muscle spindle is stimulated, the effect will stimulate the motor in that specific skeletal muscle fiber. Ganun siya. So dapat yan ang if that muscle spindle is stimulated, the same motor supplying that muscle spindle has to be stimulated to create the net effect. Otherwise, kung ibang muscle ang mag-contract, nakakaloka yon. So yan yung importance ng lateral inhibition in the anterior motor. So the motor is alpha and gamma. Again, alpha is more of the contraction, while gamma is to maintain the basic tone. Next slide. So when we talk about it, this is excited. The muscle spindle is the sensor innervation. It can be excited if there is a change in length of the muscle fiber. If it's stretched, so this muscle spindle will be stimulated. And or if there's contraction, even if there is no change in length, but there is contraction of the muscle, this muscle spindle will be stimulated. Kasi there are contractions that does not change the length of the muscle, and we call it isometric contraction. Still, even during contraction lang, there's no change of length, this muscle spindle will still be stimulated. It will send signal to the spinal cord and also to the cortex, telling you that these muscles are contracting. Next slide. All right, so primary ending, secondary ending. Sa muscle spindle, there are two types, the primary and the secondary. Let's talk about the primary muna. So kung makikita yung diagram, there are two muscle fiber, two muscles sila, intrafusal fiber and then another intrafusal fiber sa baba. So in the first intrafusal fiber, kung makikita yung nucleus niya, they are confined in a certain location na parang bag. Kaya ang tawag niyan is a nuclear bag fiber. But if the nucleus are arranged in a single file, then we call it a nuclear chain fiber. But either of the two, the primary ending will have fibers on a nuclear bag and a nuclear chain. Kaya siya primary ending or primary afferent nerve fiber in the muscle spindle. Okay, next slide. Whereas the secondary ending, look at the picture, nandun lang siya galing sa nuclear chain fiber. Wala siyang fiber in the nuclear bag. Kaya siya siguro secondary ending, no? So, ganun lang ang difference. So, primary fiber, both has a fiber coming from a nuclear bag and a nuclear chain intrafusal muscle fiber. But the secondary ending has a nerve fiber only on the nuclear chain. Next slide. All right, so static response is when the receptor portion of the muscle spindle is stretched slowly. So if these muscle spindle are stretched slowly, the number of impulses transmitted from both the primary and secondary increases almost directly in proportion to the degree of stretching, and the endings continue to transmit the impulses for several minutes. So pag static response, both the primary ending and the secondary ending are stimulated. Okay, so pag static response, slow lang yung reaction, hindi sobrang bilis ng information or ng stimulation. So, paunti-unti ka lang ini-stimulate. Okay? Sige. Next, pag dynamic response naman, sobrang bilis ng stimulation. Sabihin na natin, ito yung mga nakahawak ka ng mainit, something like that. So, sobrang bilis ng response, only the primary ending will be activated, not the secondary ending. Okay? So, when the length of the spindle receptor increases suddenly, the primary ending, but not the secondary ending, is stimulated powerfully. The primary ending responds extremely actively to a rapid rate of change in spindle length. So if it's a rapid stimulation, only the primary ending will be stimulated. It will evoke a dynamic response. If it's a slow stimulation, both the primary and the secondary ending will be stimulated within the muscle spindle and a static response will be evoked. Okay, next slide. Next slide. Next slide. Okay, before that, parang ganun lang din yung concept, no? When we talk about muscle stretch reflex, ito yung you stretch a certain muscle. When the muscle length is stretched, the muscle spindle will be stimulated. So if the stretch is so fast, static response ang kailangan, dynamic response ang kailangan mo nun, only the primary ending will be stimulated. But if the muscle fiber are stretched slowly, something like that, then both the primary and the secondary ending will be stimulated and it will evoke a static response. Next. Damping function. The importance of the static stretch reflex is its ability to prevent oscillation or jerkiness of movements, which is damping or smoothing function. So what it means to say, if you are holding a certain object, hindi naman siya umuuga-uga, di ba? Parang it's stable. And that's because of a damping function. So the muscles needs to contract statically, but hindi rin siya pwedeng mag-relax, hindi rin siya pwedeng mag-contract. Dapat sakto lang para hindi siya oscillating. So that's the damping function. It allows you to hold a certain object without oscillation or jerkiness. So that's a muscle stretch reflex in a damping function. Kasi pwede siyang static response, pwede siyang dynamic response, but kung static response man, dapat hindi nagmo-move. Parang ganon. Hindi dapat nag-oscillate yung muscle fiber contractions. Okay? Next. Okay. So let's now go to knee jerk. Knee jerk. So if you stimulate the patella, so the sensory fibers will be stimulated, and then interneuron, and then alpha motor neuron, contraction of the quadriceps. That's why your knee will try to move. Okay, so neurons, if this knee jerk is increased, neurons within the brain that innervate the gamma motor neurons and enhance the stretch reflex are overly active. The neurons that innervate the gamma motor neurons, dapat hindi ata gamma, no? I think I have to edit that. It should not be gamma. It should be alpha motor neurons. So please paki-edit, ha? Kasi this is a muscle that should contract, not a tone. So I think it should be alpha motor neuron. All right? Please correct that. It should not be gamma. Next slide. So wait, in a knee jerk reflex, if for example you have stroke, this is important only if there is a stroke, meaning cerebral infarction, that's in the cortex. So the upper motor neuron is damaged, but the lower motor neuron, which is the reflex arc, is still active. So pag i-stimulate mo yan, the knee jerk will be super active. It will tell you na this is more of a upper motor neuron lesion. Whereas if it's a lower motor neuron lesion, kahit ano mo siya, ipukpok mo siya ng ipukpok, this reflex arc is affected, then you will know. But pwede din namang, you have to be very sure kasi meron din mga taong mababa lang talaga yung knee jerk nila. Alam mo, it doesn't mean abnormal kaagad. It may also indicate that the reflex pathway is not intact, but can also be normal. Of course, it depends on the clinical setting. Next slide. Please correct that it should not be gamma, it should be alpha. All right. So let's play that video. So you try to stimulate the leg by flexing it. And then it will eventually cause, you have stretched the muscle, the gastrocnemius muscle, and then it will try to, since you have stretched the gastrocnemius, it will evoke oscillatory contraction of the ankle. So that's clonus, no? It's because of either self-excitation or another explanation there is central generator activity that arises as a consequence of appropriate peripheral events and produces rhythmic stimulation of the lower motor neurons. Nag-play ba yung video? Parang static siya to. No? Nakikita niyo ba yung video or mahina lang talaga yung arrive sa akin? Kasi dapat nakikita niyong there is that oscillatory movement of the ankle. In-stimulate lang siya, in-stretch lang siya, and then after that, it will evoke several flexion, plantar flexion ng foot. So that's clonus. Na dapat, isa lang. So you stretch the gastrocnemius, it will cause contraction of the gastrocnemius to plantar flex the ankle. But ang nangyayari yan is it will in ankle clonus there is an evoked oscillatory movement, so mag-move yung ankle niya to and fro. Next. Nag-play yung video. Okay, so we have talked about muscle spindle. That's the sensory input in a reflex arc, goes to the interneuron, and then alpha motor neuron or gamma motor neuron. So alpha motor neuron is contraction of muscles, skeletal muscles, whereas gamma is more of maintaining the muscle tone. Let's now talk about, so yung muscle spindle is the sensory input in a reflex arc at the belly of the muscle fiber. Whereas Golgi tendon is more on the tendon. So ganun din siya. So the Golgi tendon organ is an encapsulated sensory receptor through which muscle tendon fiber pass. It prevents contracting muscles from applying excessive tension to the tendons. So muscle spindle detects changes in the muscle, whereas Golgi tendon detects the muscle tension. Next. So it has both dynamic and static response as well. Thus, Golgi tendon organs provide the nervous system with instantaneous information on the degree of tension in each small segment of each muscle. Para lang ng kanina, dynamic and static response. Next. So there's another function of tendon reflex, and that's to equalize contractile force among the muscle fibers. Dapat kung magko-contract yung muscle fibers, dapat pare-parehas, hindi yung isa mahina, yung isa malakas, so it should be equal. This phenomenon spread the muscle load over all the fibers and prevents damage in isolated areas of a muscle where small numbers of fibers might be overloaded. So I think you have heard before of muscle tear, and kung sobrang excessive contraction, it can happen. So the function of the Golgi tendon reflex as well as the muscle muscle spindle is to prevent muscle tear. Kaya nga, if you overstretch a certain muscle, it has to be stimulated. The Golgi tendon and the muscle spindle has to be stimulated, telling you that it's overstretched para hindi na siya masobra pang stretch. So, ito yung nangyayari pag nag-exercise, no, yung stretching, tas na-overstretch, then it will cause spasm later on pag na-overstretch. Next. All right, so examples of flexor and withdrawal reflex. Next. So, flexor reflex is, kunwari may nahawakan kang mainit, and the muscle, it will stimulate the sensation, sensory innervation, interneuron, then motor. Tapos you will try to flex the muscles. That's flexor reflex. Pwede din naman na yung mainit is on the other side, nasa back naman siya, na hindi flexion, more an extension activity. Hindi natatawag siyang flexor reflex, but withdrawal reflex. So, pag flexor reflex, meaning to say, you remove the extremity in a flexion activity, but let's say, yung opposite naman, you try to remove the extremity from the noxious stimuli in an extension na siya na movement or abduction other than flexion, we call it withdrawal reflex. Okay? Naintindihan niyo ba to? Parang madali lang sa akin siya eh. Flexor reflex, flexion siya. You are moving away from the noxious stimuli through a flexion movement. All other movement, removing your arm away or extremity away from the noxious stimuli that is not in a flexion way, that's what we call as withdrawal reflex. Next. So, I don't know if this is, ito na siguro nun. So, flexor reflex, alam na natin yan, if you have, for example, a noxious stimuli na hawakan mo, and then it will send sensory innervation, then interneuron, then motor, you will try to contract your biceps and then contract your forearm to remove your hand away from the noxious stimuli. So may nakikita kayong cross-extensor reflex. Since nandyan na yung picture, i-explain ko na siya. So from the sensation, goes to the dorsal root, interneuron, some of the fibers in the interneuron will will cross to the other side. Let's say this is on the right side, will stimulate the interneurons on the left side, causing the muscle on the other to cause extension. So, nag-flex ka sa right mo, extension ka naman sa left side mo. So, tama ba? Nakikita niyo ba? Ganun siya, di ba? So, you remove your right hand away from the noxious stimuli and then you try to extend naman your left hand para sampalin mo kung sino man nagsunog niyan. Yung parang ganun. You try to push, you pull the right arm and then you try to push in a protective mechanism yung left arm mo. Ganun siya. Yun yung cross-extensor reflex. Next. Okay, so if we look at the myogram, eto siya yung picture na mangyayari. So you try to stimulate, okay, in 2 seconds. From the onset pa lang ng stimulus mo, from the noxious stimuli, it will cause the muscles to contract, the flexor muscles to contract immediately, instantly. Sobrang bilis. Tingnan mo, 0 onset, 0 agad magi-start din yung flexor contractions. That's why sobrang bilis ng reflex R. So flexor contraction at the onset of stimulus. However, after a few milliseconds, hindi niya mamimaintain yung flexor contraction. It will decline just a little bit and we call it fatigue. And that's because yung initial na stimulus sobrang lakas lang, and then it causes a strong contraction of the muscles. But as long as the stimulus is still there, the contraction of the muscle it will still be contracting, but not as strong as the initial contraction. So, nagtatry lang siyang pag-decline, but just a little bit. It's still trying to maintain the contraction, but not as high or as yung intensity is not the same with the first during the first time you stimulated the patient. So we call it fatigue. It will try to decline. So once you remove the stimulus, dapat stop din agad, no? But hindi ganun nangyayari. It extends, the contraction extends just a few milliseconds, and we call it after discharge. Okay? So, wala naman. Parang you're just trying to show you what really happens during a flexion contraction. Na sobrang bilis ng contraction right at the start of stimulus, and then we thought that the flexion contraction, the intensity of the flexion will be maintained all throughout. Actually, it's maintained, but it just declined just a little bit, and we call it fatigue. And we thought that upon removal of the stimulus, there is also the contraction will also stop immediately, but it does not. It extends just a little bit, a few milliseconds, and we call it after discharge. Next slide. Okay. So yung cross-extensor reflex, ito yung in-explain ko kanina na if you stimulate the right arm, there will be flexion of the right arm, but the left arm will have an extension reflex. And we call it a cross-extensor reflex because the interneuron on the right spinal cord will synapse to the other side and stimulate the extensor muscles on the left, causing extension on the left arm, and we call it a cross-extensor reflex. Next slide. Meron ata akong picture dyan. Next slide pa. Sige. For example, in-stimulate niyo yung right leg ng baby, tingnan niyo yung sa kabila nagmo-move din, no? Trying to push from the noxious stimuli. Yung right leg, nag-flex siya to remove the right foot from the stimulus. Pero yung left leg naman niya is nag-extend, trying to push from, tutulakan niya yung kamay ng ano, no? So ganun siya. It's a protective mechanism yung cross-extensor reflex. I hope naintindihan niyo siya. Kasi naintindihan ko siya. Hindi ko lang alam kung naintindihan niyo. Naintindihan niyo ba?
Yes, Doc.
Yes, Doc. So yung right leg, na-stimulate mo, flex or reflex siya kasi nag-flex yung right leg to remove the leg from the noxious stimuli. Yung push from to the noxious stimuli. Next slide. Last na ba siya? Ay, hindi pa. Ayoko na siya. Next slide. Same lang siya. Next. Alam ko na. Kasi I tried to edit this kagabi, yung gamma. Kaya nakita ko yung gamma. In-edit ko na yung alpha. So yung nasend ko yung isa. Okay. Spasms, if there is a noxious stimuli in a certain muscle, the muscle spindle as well as the Golgi tendon will be stimulated, and then it will send signals through the motor causing contraction of that certain muscle if there is a stimuli, noxious stimuli. So yung muscle spasm is because of this contraction of the muscles after the sensation, the sensory receptors have been stimulated. So the spasm results from pain impulses initiated from the broken edges of the bone, which cause the muscles that surrounds the area to contract tonically. Meron din namang muscle spasm, for example, yung peritonitis. If there's inflammation, it will cause the abdominal muscles to contract or the smooth muscles to contract because of the noxious stimuli. Para siyang positive response, no? So it will tell you that something is going on that area. So pag na-fracture ka, the muscles at the end of the bone fracture will be contracted because the noxious stimuli is there. So it will keep on stimulating the muscles to contract. Kaya siya nag-spasm. Ganun din pag mag-exercise ka. So you stretch the muscles. And so kahit hindi siya nag-overstretch, but you keep on stretching the muscles for a long period of time, you exercise for, let's say, 2 hours, hindi ka naman nag-exercise. So eventually, the sensory innervation will evoke signals trying to stimulating that muscles to contract. Kaya ka nagkakaroon ng delayed onset muscle spasm. After mag-exercise mo ng 2 hours, hindi mo pa mararamdaman yung pain yan. But after or a few hours later, yung muscles na yan will be contracting. So we call it a spasm, muscle spasm. Next. Spasms occurring muscles that surround a broken bone, abdominal muscle spasm in person with peritonitis, and muscle cramps. Nasabi ko na. Next. Yes. So, yung autonomic reflexes in the spinal cord, so hindi naman to on the skeletal muscles, but these are more on the smooth muscles. So there are autonomic reflexes, although we will discuss this once we talk about the autonomic nervous system, but let's just try to give examples of the autonomic reflexes in the spinal cord. Next. So meron kang sympathetic pathway and parasympathetic pathway na so if you stimulate this pathway, it will cause changes in vascular tone resulting from changes in local skin heat. So, for example, you put a hot pack on the skin surface, it will cause vasodilation. So the smooth muscles will try to relax. So there is vasodilation. There is increased blood flow to that area. Yan yung nangyayari. That's an autonomic reflex. Kasi yung vasodilation ng arterioles, hindi naman siya skeletal muscles, di ba? So these are smooth muscles. So that is through an autonomic reflex in the spinal cord. Sweating, for example, which results from localized heat on the surface of the body. Yung pag-sweat mo naman, that's sweat glands ang na-stimulate dyan. So hindi naman siya din skeletal muscles, no? So that's still autonomic reflex. Ganun din sa intestinal reflexes that control some motor functions of the gut, peritointestinal reflexes that inhibit gastrointestinal motility in response to peritoneal irritation, and evacuation reflexes for emptying the full bladder or the colon, and then the mass reflex. Yung mass reflex, ito yung discharge if there is damage to the spinal cord. Sobrang if I have a patient with a spinal cord injury, napakahirap i-manage kasi fluctuating lahat ng blood pressure, tataas, biglang bababa, tataas, biglang bababa. And then it's an autonomic discharge na mass reflex. If that happens, high mortality. So we will talk about more of these autonomic reflexes in the spinal cord once we discuss autonomic nervous system. Ako din yung magle-lecture niyan. Okay? I think that's the last. Yay! Tanggalin mo yung sinishare. And do you have any question? Hi, Doc. Is cross-extensor reflex also applicable on our arms when we are walking? Hindi. Yung ganon? Maybe, hindi ko naisip siya. Oo nga, di ba? Di ka naman naglalakad ng ganon, no? Parang ganon. Maybe, yes. I think pwede siya as an example. Matagal na po kasi akong curious kung bakit may opposing movements yung dalawang arm natin kapag naglalakad tayo, especially kung wala tayong dinadala na bag. I think yes, I would say yes, that's part of a cross-extensor reflex. While the other arm is flexing, the other arm is extending. So, ganun siya, alternating movements. And that's in an unconscious level. So I think that's also an example of extensor reflex. Question pa? Saya, no? When physical therapy kasi ako, yung favorite ko talaga is spinal cord ever since. So, meron kaming, as far as I can remember, meron kaming parang oral exam. I don't know kung anong term yan. May oral exam kami. Before ka mag-graduate, meron kang oral exam. So, bubunot ka kung ano ba, stroke, ganyan. Gusto ko talaga yung mabubunot ko is spinal cord injury. Mas favorite ko yung spinal cord. Buti na lang spinal cord yung nabunot ko. Kaya I passed. question? No question? If there are none, so bukas wala tayong lecture. I'll see you on Wednesday, 10 to 11. Again, palaging 1 hour lang lecture ko. Ayaw ko magsalita more than an hour.
Okay po, Doc.
Wala na?
Hindi po daw.
Alright, bye-bye. Good morning.
Thank you, Doc. Happy lunch.
Bye-bye.
Thank you, Doc.
Thank you, Doc.
Thank you, Doc.
Thank you, Doc.
Thank you po, Doc.
Doc, same Zoom account, same Zoom
Yes,
link
palaging
po.
same talaga siya, Z. Palaging same. Huwag tayo mag-change. This is
Okay
my,
po.
my recurring meeting to. Bye-bye.
Thank you, Doc.
Thank you, Doc.